Welcome to Masticatory channel. I am Dr.Aruna Shanmugavel. Let us see a motivational quote. The moment you start believing that things will work out, everything begins to change. Observe the picture. What are the muscles attached to the ramus of mandible? The external surface of the ramus gives insertion to the muscle masseter. The coronoid process gives insertion to the muscle temporalis. Pterygoid fovea gives insertion to lateral pterygoid muscle. The area below and behind the mandibular foramen gives insertion to medial pterygoid muscle. Out of these four muscles, except medial pterygoid, the other three muscles are supplied by anterior division of mandibular nerve, whereas the medial pterygoid is supplied by nerve to medial pterygoid, which is a branch of the main trunk of mandibular nerve. Look at these fibers. These are the fibers of medial pterygoid muscle. So nerve to medial pterygoid is going to supply medial pterygoid muscle, and that arises from the main trunk of mandibular nerve. Whether this nerve to medial pterygoid is going to supply only medial pterygoid, or is there any other structures supplied by the same branch? Yes, the nerve to medial pterygoid branch gives a twig to otic ganglion, and these fibers will not be relayed, and they are going to supply two muscles, tensor tympani and tensor veli palatini. Observe this picture. This is the nerve to medial pterygoid coming to supply the muscle medial pterygoid, and it gives a twig to otic ganglion. These fibers will not relate and going to supply two muscles. One is tensor palatini, the other one is tensor tympani. And this twig is called as the motor root of otic ganglion. Each ganglion will have sensory, sympathetic and parasympathetic root. This otic ganglion has an additional root, that is motor root, which is going to supply two muscles, tensor palatini and tensor tympani. Let us wind up this session with a quote. The words of the tongue should have three gatekeepers. Is it true? Is it kind? Is it necessary? Thank you for watching.